Hello, and welcome to today's episode of The Scoop, hosted by Abundant Senior Living Solutions, where we help seniors overcome obstacles proactively. Today, joining us is going to be Dr. Gina Dawson to educate us on senior fall prevention because today is National Fall Awareness Day. Dr. Gina is a licensed physical therapist and is currently the Director of Physical Therapy at Methodist Ambulatory Surgery Hospital. She is a passionate advocate for Methodist Healthcare's Stay Upright Fall Prevention Program and has shared knowledge with seniors and caregivers for 4 years. Thank you so much for joining us today, Gina.
Thank you so much for letting me share information. This is so important.
It is so important. I'm going to be asking Dr. Gina, several questions today, and hopefully by her answers, it's going to be able to help our audience be a little bit more proactive about fall prevention. So how long have you been practicing in your current setting?
I've been at Methodist Ambulatory Surgery Hospital for 25 years. I actually started with Methodist Healthcare when I was a junior volunteer at the age of 15, so I've been there my whole life.
Oh my gosh, you've grown up there.
I have.
So what is your main focus there?
So at the hospital, I see patients who have had total joint replacements. We specialize in total knees and hips. But what brought me into looking at fall prevention is because oftentimes people have orthopedic problems due to a fall. And so we are seeing people that are coming in having to have their hips or knees replaced because of a fall, or unfortunate after having a joint replacement, have a fall and then have to come in and have a revision.
I see. So what drives your passion for educating the public on fall prevention?
Because 70% of falls are preventable. If we can teach a patient how to prevent a fall, then that could save a person from losing their independence. Because 70% of falls are preventable, those 30% are the ones that we are unfortunately happen.
So this is really important because we see this a lot as we're helping seniors. So the prevention piece, let's talk about that a little bit. Are hospitals seeing more injuries related to falls?
Definitely. We are having an increase in the amount of seniors. And so as the baby boomers are getting older, they're approaching their 60s, and we also have a large population there in their 70s and 80s. In the next 10 to 20 years, we're going to have patients and people that are in their hundreds, the centurions. And this is probably going to be the first time in history that we're going to have so many 100-year-old people. So with that comes falls, unfortunately, injuries from falls that have occurred, especially in those that are the age of 60 and older.
Wow. So this really ties into what we hear a lot being talked about with the baby boomers and the healthcare field really kind of gearing up to be prepared for that, right?
Exactly, yes.
What are some practical things that seniors can do to prevent falls?
So the National Council on Aging has identified 6 tips to fall prevention. The first one is staying as active as possible. Okay. Exercise is so very important. So if we can increase the strength in our abdominal muscles, leg muscles, our standing and weight shifting muscles, that will help maintain balance. The second tip is making sure that you communicate with your physician if you're losing your balance or if you have fallen. There are many things that a physician needs to look at. Looking at the blood pressure, not only in the sitting but in the standing position and in the laying down position, making sure that the blood pressure is changing correctly. Also looking at the medications. That's the other thing tip number 3 is making sure that the medications that the person is taking is appropriate. There's a list of medications that we can talk about. There could be a whole segment on just that alone, but making sure that the medications are taken properly and also that the side effects are not causing the fall. The 4th tip is making the home as safe as possible.
So important. Clutter, right?
Yes, clutter. Methodist Healthcare has a website link, and the link is to a book. It's called Check for Safety. And so this is a really good link, and what you can do is you can go online and you can see the book and actually download it, and it goes through room by room on how you can make the home as safe as possible. So making the home, getting those tripping hazards out of the way, moving shoes, toys, pets, being aware of things that are on the floor, increasing lighting, there's many things that we can do to make the home as safe as possible. Another tip is get your hearing and your vision checked annually. Getting new glasses is very important, but also hearing. There's studies that show that your hearing also can affect your balance. And then the last tip is communicating with our family members and our caregivers on how we can be safe, or maybe that we're feeling that our bodies are changing, and making sure that we're communicating the changes that are going on in our bodies.
So proactive communication is very important. Don't try to hide it from your family. Your loved ones love you. So make sure that when you start to see some of these changes that that Dr. Gina has mentioned, that you make sure that you communicate with your family, because your family is your support group.
Exactly right.
Mm-hmm. Yeah. What would you recommend a person do if they haven't necessarily fallen, but they're losing their balance more often?
Do the home safety checklist. Make sure you get your home as safe as possible. Also, identify maybe what's causing the loss of balance. Is it your shoes? Is it that you're getting a little bit of weakness? There is a decline in the strength of our bodies. And so we want to make sure that we're identifying perhaps we need to be evaluated by a physical therapist. Being evaluated by a physical therapist is very helpful, because then weakness and loss of flexibility can be identified, so that way maybe the loss of balance hasn't caused a fall yet, but those deficits can be looked at and improved on.
Yeah, absolutely.
And also talking to your doctor about if you are feeling like you're losing your balance, because something may be changing.
And it could be a medication, like you mentioned. Some of those basic steps you went through a few minutes ago could be the reason, right?
Exactly right. Or something neurological, or with your heart, or the lab values in your body may be off. And that could make the lab values in your body may be off, and that could be a cause of lightheadedness, or feeling dizzy, or losing your balance.
And as I had mentioned, your family, your doctor, communicating with your doctor is so important. The doctor is not somebody you should keep things from.
Exactly right. Because when we fall, it's embarrassing, and
right.
It's very common to not want to share that you've fallen, because it feels like you're losing your independence if
right.
you tell somebody that you've fallen.
Or you've done something wrong. I think sometimes they feel ashamed, right?
Maybe so.
Yeah.
Yes.
What advice would you give a caregiver who's witnessing their loved one struggling with an issue, and how would you empower them?
I think the words that we need to share with our seniors is that you're not losing your independence, you are keeping your independence. This is a new season, and we want to change the way things are done. So I think looking at those tips that we talked about, and making sure that we empower them, is saying we're keeping your independence, because most seniors want to age in place, and that's what the idea is making their environment safe, making them as safe as possible.
Yeah, these are very good tips. Do you have any closing words of wisdom to share with our audience from your experience with patients who have fallen?
The number one thing that patients tell me after they have fallen, they come to my hospital, and they say, I ask, what is something you would have done differently? And they oftentimes say, I would have taken my time. I would have just slowed down.
Oh, slow down.
Try not to multitask so much.
And breathe, just breathe, right?
And be aware of yourself. Be aware of where you are in space, and plan out what you're going to do. Take your time, and just know that your body is changing, and that's just what happens. And we just want to maintain our independence by being as safe as possible.
Well, I think these are all great tips that you have shared with our audience today. Thank you so much.
Thank you.
I've learned a lot even. As we all age, I think it's important tips for us all to keep in mind. We do become more fragile as we age, and keeping these tips and to help us stay safe is so important. We'd like to thank you again for joining us today for our episode of The Scoop. And remember, if you ever need help with your loved one, our services are free. We're also going to leave some of Dr. Gina's links that she has, where you can get some of these wonderful tips to prevent fall, because it is Fall Prevention Day. We will have these on our links below, so that you'll be able to click on these and you can download some of these books that she discussed today. Remember, if you have any challenges that you're facing with your loved ones, Abundant Senior Living Solutions is here for you. Please contact us. Our services are free, and our number is on the bottom of the screen.